I'm a member of several national women's groups, including the Coalition of Activist Lesbians. We were formed way back in 1994 because we found that LGBTI, it was only LGBT then, they hadn't added the extra letters from the alphabet, that our voices as women in the movement and our needs as lesbians were being ignored, and we disagreed with quite a lot of the campaigns that were run in our name. We're the only lesbian organisation that has accreditation to the United Nations. I lived through, and I'll just give a little history, can't help being a sociologist, I lived through that time when homosexuality was criminalised for men, but it was highly pathologised for women. I have been in a heterosexual marriage and had a daughter. However, at the end of that marriage, my partner went to court to gain custody of our daughter on the grounds that I was psychologically unfit as a mother, because at that time, this is the late 70s, lesbianism was still classified as a psychiatric disorder, and I was considered a danger to the care of my 2-year-old daughter. I had more than 2 years of court cases, a lot of money, and this was a policy that was sanctioned by the government and implemented by the family court. So I really understand the implications of government legislation and how it impacts on the lives of people who are the target of legislation. I had a number of friends who lost custody of their children and their families are fractured still. A very close friend had 3 children. She went to 3 different solicitors and lawyers in Melbourne. None of them would take her case to the family court because they said, "You're wasting your money, you will lose." She did not go, and her children still feel that their mother abandoned them. I'm also very sceptical, like women of my age and watching all of this, of treatments that are based on medical consensus and not clinical evidence. We are in grave danger of repeating some of the mistakes of the past with this legislation, particularly in relation to treating children with off-label drugs and cross-sex hormones that will render them infertile, chemically sterile for the rest of their lives. The treatments that are being given to children, particularly teenage girls, have no clinical evidence. This treatment and the onset of early gender dysphoria is very recent. We have no longitudinal data to tell us whether it is effective or whether it's safe. At the very least, we should be opening up treatment opportunities, not closing them down to one preferred method of affirmation. Part of the scepticism that I have of policy that's based on medical consensus rather than clinical evidence is, during my time, I have a friend who was in a very bad car accident. She was unconscious, and her mother asked the surgeon to perform a frontal lobotomy or the ice pick frontal lobotomy procedure on her. Fortunately, this surgeon did not oblige, but at that time, frontal lobe lobotomy with an ice pick was considered a cure for homosexuality in both men and women. The person who perfected this procedure and taught it throughout the States and other countries was awarded a Nobel Prize for that procedure. The clinical evidence against using that procedure when it started to be collected was overwhelming. So, likewise, I'm a skeptic, and it bothers me that there is no clinical evidence being used to mandate a preferred treatment model to protect the health of our young children. The Jakarta principles around gender identity are those that have informed this bill, and it is very much the language of those principles that we see in the bill. Language is the main strategy in which gender identity ideology is being introduced into the laws and policies, often without us even noticing. It is this that will lead to criminalising health professionals who dispute the assumptions and the clauses about conversion therapy in this bill. Cole argues that the bill needs to distinguish between children and adults, the ideology of gender dysphoria in adults and the ideology for rapid onset amongst teenage girls is very dissimilar, and yet the legislation is treating them as though they are the same. Cole has recommended that watchful waiting is the preferred approach because it opens up options and it doesn't close down young people's reproductive futures and the desire, and when they're in their mid-20s, to create families of their own. We have a big problem with the definition of sexual orientation. The usual and widely used definition is an enduring pattern of emotional, romantic and/or sexual attractions to men, women or both sexes. That's from the American Psychological Association's dictionary, but they're very similar ones. However, this bill disconnects sexual orientation, whether it be same-sex attraction or heterosexual. It disconnects the reality of physical bodies from sexual orientation. The definition in the bill says, sexual orientation is the person's capacity for emotional, affectional, sexual attraction to, intimate and sexual relations with persons of a different gender, the same gender, or more than one gender. Now, Maureen referred to the meaning of sex and gender. Now, if you don't name it, you can't see it. And in this definition, you can't see heterosexual, that is, the sex side of sexual attraction, or homosexuality. Sex has been replaced by gender, that is, the behavioural stereotypes, appearance, superficial things. This is one of the foundations of why young people might be confused about sexual orientation and their gender. I just want one case study, and try to stay with me. I'll try not to do your head in. And this is an actual case study. James is the heterosexual husband of Carol. He decides to surgically and legally transition to a woman. He now identifies as a lesbian and expects Carol to do likewise. They go to lesbian events as a lesbian couple. However, Carol doesn't feel comfortable socialising as a lesbian and consults a psychologist because she wants to try and save the marriage. The definition of sexual orientation in this bill means heterosexual Carol is now indeed a lesbian, because she is in a relationship with someone who is identifying as the same gender as she is. That's the job of changing the word sex in sexual orientation to gender. It is actually really muddying the waters. You could ask how on earth would a psychologist navigate around this bill to support Carol and her sexual orientation in this situation. It's very likely the psychologist would be acting in a criminal way in terms of changing orientation. This is not an isolated incident of women who are in relationships with men, mature age men who transition later in their life. Fortunately, they won't have to, because Carol ended up ending the marriage. Around 40, one major study that's been done, around 40% of young women who experience rapid onset gender dysphoria have a non-heterosexual orientation. And one of the reasons that they express is that either they are attracted to girls and it's much easier to hold hands with their girlfriend if they're a boy. They don't cop the bullying, the disparaging comments. The other is, based on the comment of Maureen, is that if they're interested in things like playing football or cricket, their view, given some of the definitions, is that they must really be a boy. Now, I was one of those people who played cricket. I never once thought I was or wanted to be a boy. I just wanted to be a really good cricketer. The word lesbian and the word heterosexual has become meaningless with the definition that is used in this bill. A lesbian now is a woman who can be with a person who was born male or with a person who was born female. The meaning of lesbian as same-sex attracted has been erased from the definition in this bill. Similarly, heterosexual is also meaningless. It now includes partners who are the same sex as you. And I reckon everyone in this room knows exactly how sexual attraction works. And it's not about gender, and you can't ideology your way around sexual attraction being a biological reality. And logic would demand the definition of sexual orientation in the bill ought to change to gender orientation. And clauses where sexual orientation is used should be changed to gender identity or orientation. We're not asking for that, but logic from the definition that's used. And we should describe ourselves to be consistent with the definition and the change in the language, and it is a big change in language, that you are a heterogenderal, I'm a homogenderal, and there are probably people who are bigenderals, in order to be consistent with the sexual orientation definition in this bill. The other issue is the capacity. The concept of sexual orientation being in relation to who you fancy, which is sort of pretty obvious, has been also taken out of the concept of sexual orientation. It now is a capacity of you to be attracted to someone. It's a bit like having a good backhand when you play tennis. It's no longer a relational concept, but an individual one. One of the problems with such an idiosyncratic definition is that it takes away the protection of children from adult ideas and diagnoses of their gender expression and their sexual orientation. It puts gender non-conforming children at a very high risk of believing they need to transition to fit in. Cole objects to the conflation of sex and gender. We also object to the lack of a coherent definition of identity, which is both an innate property and also gender fluid. You cannot hold those two ideas simultaneously. And we are very concerned about the exclusion of drug therapy for treatments from the concept of conversion. And we object to transitioning children before their identity or their sexual orientation has even had a chance to develop. Children are placed on puberty blockers around the age of 12 to prevent any maturation of their ova or their sperm. The majority of children who go on puberty blockers proceed to cross-sex hormones, and they are rendered chemically sterile. And I can't believe that this government would actually have a bill that criminalises practitioners who don't want to sterilise children. Thank you.